You can be perfectly healthy, but a sudden temperature drop, like shifting from bright summer straight into a cold winter, often disrupts your body's baseline defenses. That environmental stress opens the door for biological triggers. Typically, this is a viral infection, like a rhinovirus or coronavirus, taking hold in your upper respiratory tract. Once that infection sets in, your immune system mounts a defense, and that reaction produces a highly predictable cluster of physical symptoms. It almost always starts highly localized and relatively mild. You develop a runny nose, you start sneezing, and feel a scratchy sore throat. But if the immune response intensifies, the localized irritation escalates into systemic symptoms. That runny nose turns into severe structural blockage, your muscles start aching, and your body temperature rises into a low-grade fever. Because these physical reactions range from a mild sniffle to a severe full-body fever, treating a cold as one monolithic illness is a mistake. It usually leads you straight to the wrong medication. This creates a real problem in the pharmacy aisle. You're standing there staring at dozens of boxes, trying to guess if you should buy a basic single-ingredient pill or grab the maximum strength combination pack. The trade-off is steep. If you take a heavy combo drug for a mild sniffle, you subject your organs to unnecessary side effects. But if you take a basic weak pill when you have a fever, you get absolutely no relief. To solve this, we use the 4-tier cold protocol escalation ladder to match exact symptoms to medication strength. It aligns drug complexity with symptom intensity, moving from narrow, targeted interventions at the bottom to broad, systemic treatments at the top. Before you consume a single active ingredient, you have to identify exactly which rung of this ladder you are currently standing on. Let's start at the bottom. Tier 1 is designed strictly for baseline single symptom relief. This is where you stay if you only have a persistent runny nose or a sneezing fit. For these symptoms, the primary drug class you need is an antihistamine. When you look at the back of the box, you are searching for specific active ingredients: cetirizine, levocetirizine, brompheniramine, or chlorpheniramine maleate. These drugs work by shutting down the body's histamine response. By halting that allergic reaction, they effectively and quickly dry up excess nasal secretions. However, antihistamines have a major limitation. They are completely useless against physical pain, and they cannot clear structural nose blockage. This flowchart illustrates what to do when a runny nose escalates into severe blockage. You move down to Tier 2, utilizing the congestion add-on. Instead of swallowing pills, you apply topical nasal drops containing phenylephrine, oxymetazoline, or xylometazoline directly into the sinus. Because you apply them locally, these decongestants rapidly force those passages open without requiring your stomach and liver to process any extra medication. Tiers 1 and 2 are highly effective, but they are strictly localized defenders for your head. Once the infection triggers full body symptoms, they fail completely. You cross the threshold into Tier 3 the moment your symptoms expand outward from your head, to include deep body aches and a low-grade fever. This requires a heavier pharmaceutical solution, all-in-one combination drugs, widely sold under brand names like Cheston Cold or Cinarest. This mathematical formula graphic breaks down exactly what is inside a Tier 3 pill. It combines an antihistamine, like levocetirizine, plus a decongestant, like phenylephrine, plus an analgesic, like paracetamol. The benefit here is sheer efficiency. You manage the entire spectrum of severe cold symptoms simultaneously with a single dose. Morning tone. However, taking this combination pill without a fever or aches results in unnecessary systemic exposure. If you only have a runny nose, taking a Tier 3 drug forces your liver to metabolize heavy pain relievers for absolutely no benefit. Tier 3 is a powerful tool, but it must strictly be reserved for a fully compromised immune system. It should never be used as a shortcut for a mild sniffer. Occasionally, you will hit a wall. In a refractory case, you spend days properly utilizing Tiers 1 through 3 over-the-counter medications, but your symptoms remain unresolved. When you reach this point, it is time to halt the self-medication and escalate to Tier 4, clinical intervention. Doctors will typically introduce a stronger first line of defense, prescription steroidal medicines. By utilizing high-end steroids like dexamethasone and betamethasone, a medical doctor can aggressively shut down that severe, lingering upper respiratory inflammation that standard OTC pills simply cannot touch. If even those steroids fail, the absolute last resort is to deploy leukotriene modifiers, specifically montelukast combination drugs like Levocet M. Moving up to Tier 4 means abandoning the convenience of the pharmacy aisle. You trade over-the-counter access for necessary medical supervision and systemic, prescription-grade power. Using a higher-tier medication for a lower-tier symptom adds physiological risk without adding any practical relief. This comparison matrix provides a final evaluation framework, allowing you to map your current physical state to the correct pharmacy shelf. If you match Profile 1, the mild sniffler, stay strictly at Tier 1. Use basic cetirizine to handle the runny nose and avoid the side effects of heavier drugs. If you fit Profile 2, the fully compromised, bypass the lower tiers entirely. Jump straight to Tier 3 combo drugs to treat your simultaneous fever, aches, and congestion. And if you are Profile 3, the persistent sufferer, abandon over-the-counter efforts altogether. Seek a doctor for a Tier 4 steroid or leukotriene evaluation. Cold recovery is optimized when you match the precise pharmaceutical tool to your specific biological problem. Nothing more and nothing less.